Hello, we're here with Anna Burke today. She welcomed us into her lovely home to ask her a few questions about PCOS. I value her opinion and I'm sure you will too. So I have a few questions for you today, Anna. And I wanted to know, how can you explain what PCOS is to everyone?
PCOS is classified as endocrine disorder. What this means is there's syndrome X, which men get, which is a metabolic disorder, and women have what's called PCOS, polycystic ovarian syndrome, which is an endocrine disorder because our ovaries get involved in the picture of how things go. So PCOS is actually, in my definition of it, it's a label for a host of complications that happen when the body has depleted its supply of progesterone. Okay, so there's a lot of estrogens that are entered into our body through our foods, cleaning products, cosmetics, things of that nature. And these xenoestrogens, or phytoestrogens, which are from soy, they basically run out your supply of progesterone in the body. So then the body starts making testosterone to balance it out, and then a host of other things start to happen. So PCOS is actually, it's kind of just a title that they put on all these symptoms that come up, but in theory it's considered an endocrine disorder. Okay,
wow. And just to piggyback off of what you said about the men, what was the title of?
Syndrome X.
Syndrome X, okay. And that would be kind of related to what women kind of go through.
Yes, they actually are very similar, except that they don't get the female issues that we get. So they don't have, the menstrual cycles and infertility issues because it doesn't affect them that way. They get the weight gain, they get the increase in baldness, and they get insulin resistance. They have, the things that are not pleasant for anyone to experience. They tend to get really distended abdomens because they gain a lot of weight in their midsection because they too are getting an excess of estrogen.
Wow, and that's something I didn't know. So now there's a relationship to show that it's not just about women. This could affect men as well, so that's great. Now, how important would you say is a balanced diet for women with PCOS?
A balanced diet is, it just depends on what you mean by that, because if you're talking about the USDA pyramid for a balanced diet, I would never recommend that for a woman with PCOS because it's too heavy in the carb division. We want to make sure that our carbohydrates are really low because we don't metabolize things properly. That's why it's a metabolic issue. Okay. When you consume foods and they're high in carbohydrates, you secrete a lot of insulin to try to combat that. But because most of the standard American diet is based around omega-6 fats, so your corn oil, your soy, your partially hydrogenated oils, they build your cells, so they're actually reversed. So your insulin receptors are inside the cell instead of outside the cell. Okay. So it can't bring in, that's what insulin resistance is. It can't bring in the nutrients that are needed through the insulin receptor. Okay. So you end up in a cycle.
Well, I understand. It is a cycle that just keeps going and going. That's
going.
Why. Right. But this is something that you definitely will talk about a lot more. We have a little surprise where you'll go into some of the foods that are good for us, so we'll leave that for later on. But that was just a good snippet just to give you about the diet. Now, this is another question that I have that a lot of women have been asking me about sleep apnea. Is that a common symptom of PCOS, or is it not related at all?
It's actually considered a common symptom. It's 50% of women with PCOS experience sleep apnea.
Wow.
Exactly why they're not positive. It's speculated that it could be because of the weight that they carry. So when they're sleeping, they could be having obstruction problems while they're sleeping. But I was surprised myself because I looked into it a little deeper because I have a support group and people ask different things. And sleep apnea is actually 50%.
Okay.
That answers the
question. All right, and another question I have is about skin tags. And I see this a lot in women with PCOS. They have skin tags, and then I see some that don't. So what is that? How can you explain that? Like, why do some have it and some don't?
Commonly, skin tags happen from abrasion on the skin. So usually women will find they have it around their waistline, around where their socks are, if their socks rub against their ankles, and their thighs, if their thighs rub together. And because excess weight is one of the main, contributors to PCOS, it tends to happen that way. They aren't exactly sure why, but they do say that the abrasion is what happens. The discoloration tends to be in the same places as the skin tags.
But every woman that has PCOS or every woman that has a skin tag, it doesn't necessarily mean that it's related.
It's just a side effect of being... I mean, because if you're overweight without PCOS, you're probably experiencing the same thing.
Okay. All right, just to clear that up. Yeah. Now, let's get into the pregnancy side of it, because I know that's like a big topic with PCOS. And how can you explain as far as like why is it harder for certain women to get pregnant with PCOS when they...
A lot of that has to do with irregularity of their ovulation cycle. They don't ovulate regularly because they have so much testosterone in their system. So with the increase in male androgens, the egg isn't released as naturally or as normally. So that can be corrected, and it doesn't have to be medically. There are drugs that you can take, but you can actually correct your insulin imbalance, correct your estrogen imbalance, and then you can actually become pregnant naturally that way. And then you'll ovulate more regularly.
Well, that's what I was going to ask you about. What was the next step? So there are ways to get pregnant naturally and medically, and they can see results from both sides of what they choose to do. So that's an excellent way not to feel like the women have to do one particular thing, like they have options. And that's something that a lot of women with PCOS don't feel like they have as options, but you do have options.
Right, and that's mainly because the medical community is not exactly supportive of the natural remedies. I'm a natural person, so I tend to go that route with people. But yeah, there's lots of things that you can do to increase your progesterone, decrease the testosterone, and they don't require drugs at all. That's true.
And I'm trying to do the more natural side of it, so hopefully some of the women will do that as well. Now I have one more question. Aside from the pregnancies, another subject that I hear a lot is about the hair problems. Now there's two different problems which take me for a loop. Some women have hair in places we don't want the hair, and in the places we wish we had hair, we're losing that hair. So why is it like, is our body confused and where the hair is supposed to be growing? What's going on with that?
That's one I'm very, very connected with. Out of all the PCOS symptoms I've had, that's the one that still hangs on, is the facial aspect of it. My hair has regrown. I was thinning really badly, but it's come back. It's more full now. But what happens is, again, it's the testosterone in your system. So when your body ran out of progesterone, and each nationality of women, which is why they say it's hereditary, it's not really hereditary in the sense that you could have a child and she'll be born with it because it's hereditary. You pass down your eye color, you're passing down PCOS. What it is your genetics and your nationality. Every woman has so much progesterone that she can produce in her lifetime. The quicker you burn that out, the quicker PCOS symptoms will set in. Mediterranean women, we have the lowest progesterone production. So usually Mediterranean women end up getting it first. Yay!
Oh wow, I didn't know that.
Yeah. So you need to find ways through diet. There are supplements that you can take. This transdermal progesterone that you can apply that will help to increase that. So so once you get your testosterone under control, then the hair will start to grow back, and then you can have supplements that will help increase, like biotin and things of that nature.
And you'll be able to help us a little bit more on what the confusion that I kind of see is, what is the amount that we should take, and that's something that we want everyone to look forward to you explaining as far as the supplements in more detail, which you would definitely go into, and the amount, because that's something that I definitely want to know as well. Another thing I wanted to ask you is, what do you feel, I know I went over some of the symptoms, but what do you feel is the most common symptom of PCOS? Did I name that, or is there something that I left out?
The most common symptom is actually
She has notes. She's
I have
well
notes.
prepared.
I have notes.
And that's a great thing. She did her research.
Yeah, because it's actually, there's a list.
Okay.
Because there isn't just one most common symptom. Because it's a variety of symptoms that affect you, there's actually several, and I just couldn't remember the whole list. So
That's fine. Well, we want the accurate list, so we appreciate that.
The accurate list is, drumroll, acne,
Acne.
facial hair, thinning hair, irregular periods, fertility issues, and depression. So basically everything we just talked about that are pressing on people.
Wow. Well, we didn't go into depression, but that was the next question. So, what is go into the depression and why women are depressed with PCOS? Because I don't want the world to think that we walk around and we're just miserable people, but we do have a reason to have our down days. So could you go into like why we are at a greater risk or of any type of risk of being depressed once we're diagnosed with PCOS?
Definitely. Usually depression is triggered from a niacin deficiency. So women who are polycystic tend to be nutrient deficient because our bodies are not operating optimally. So with that aside, there's a lot that goes into PCOS. Mm-hmm. So, I mean, I remember the days where I felt terrible about myself. You know, you have, you know, weight that is out of control. You think you've done well and you ate perfect and you get on the scale and you gain 2 pounds, you know. Yeah. And if you don't understand what's making that cycle happen, it gets, you know, wears down, and how much time you have to spend with hair thinning and your face, you know, growing hair or shouldn't be growing. It starts to weigh down on people and they feel depressed. They definitely experience a lot of down times. So that coupled with nutrient deficiencies stimulate depression.
Okay. And what would you give as far as like an advice tip or any type of advice from someone who is going through depression right now, that's like watching this and they're like, I'm depressed and I'm like at the verge of just going off if someone doesn't just tell me what I need to do? What would be your advice?
Well, the first thing that I did for myself was I started carrying positive affirmations in my purse everywhere I went. And it was probably the most helpful thing. And I wrote down, you know, it's like, I used to be able to recite it verbatim, but I don't remember it exactly now. But it's like, I am a Burke. I am, you know, a beautiful person. I carry myself with pride. I'm intelligent. All the things that, even if you don't feel like you are that, you're going to tell yourself you are that. Mm-hmm. So you start to change the shift, you know, of how you project towards yourself and then outwardly towards other people. So the first step is to change how your mind sees the condition and how you are, because you're not the condition. Mm-hmm. You know, it's a part of your life and will always be a part of your life, but it's important that you see beyond that. Mm-hmm. In order to make changes that are lasting, you have to change your point of view and how you see yourself.
That's true. And I feel like that's more the first step. Most women, when they find out that they have PCOS, it's like, what do I take? What do I do? Right. And I believe the first step, if you could just calm down, because, you know, that's the first step for me, just to calm down and do what you said. That was beautiful advice for them to just build their self-esteem. Because you could have high self-esteem and then you find this out and it could bring you down. But your advice is very good on that. So we appreciate that.
Thank you.
And we just thank you for bringing us here to your home and answering these questions. You did an amazing job. Thank you.
Thank you.
And we're going to have more from Anna Burke. She has a lot more to share with you guys, so just keep watching.